Experts on the front lines of the deadly opioid crisis are describing the province's move to support drug consumption services as a breakthrough in Alberta. There have been close to 200 fatal fentanyl overdoses in our province already this year. And now the province is working towards the possibility of a place where people can take drugs under supervision to try to stop what some experts have called a public health emergency. Now, 3 of those experts wrote a frank CBC editorial a few weeks back calling for more action from the government. Dr. Hakique Virani was one of the article's authors, and he's an addictions and public health specialist. Welcome back, Doctor.
Thanks for having me again.
Now, last time you were here, we talked about why you think safe injection sites are vital in the fight against fentanyl and other opioids. Remind us of your argument.
I mean, the most basic part of the argument is that they save lives. And we're in a scenario where over 300 people in the first 9 months of this year have died from opioid overdose. We know that supervised injection services or supervised drug consumption services allow people to use drugs, as you say, in front of health professionals who can be there in case something untoward happens. But there's other reasons why it's a good service to offer. One is it gives a touch point for people who use drugs into healthcare. For most of us, healthcare is a pretty intimidating system. And certainly if you're somebody who uses drugs and is faced with stigma and judgmental professionals from time to time, this is a safe place for them to come and ask for more services if there are other things that are wrong in their life or with their health.
Right.
And we know that in places like Insight in Vancouver, that actually happens. People who use safe injection services in Vancouver are more likely to seek out addiction treatment.
The province is now moving towards this, as we've said, providing $750,000 to groups who want to open these facilities. How do you feel about this change in direction?
Well, I am very encouraged by it. I mean, we have some barriers in federal legislation that need to be removed toot sweet. But while those are still there, the provincial support to pursue an application for an exemption under federal legislation is critical. I'm glad that it's happened. I wish it would have happened years ago. But here we are, and hopefully we can move very, very quickly towards establishing these services.
Yeah. Now, the proposal on the table for the Edmonton site sees it operate a little differently than Insight, as you mentioned, in Vancouver. What do you think about that?
Well, I think it's very interesting to integrate these services into places that offer already healthcare to people who are likely to use drugs. I think that's a great approach, for a couple of reasons. One is it becomes less objectionable to a surrounding community who might have some apprehensions about a supervised injection site. But it also puts those patients in proximity to other healthcare services that we talked about might be important for their overall recovery and overall health. So I think it's a brilliant concept. And also might help us get around some of the geographic difficulties of having a single site. That's
right. Now, of course, there is urgency in this situation, but it could take 8 months to put together the proposal, and then, as you mentioned, it has to go through federal approval. So is that worrying for you?
Well, any delay in any of the interventions that we had described as critical life-saving interventions in this public health crisis is bad. But at the same time, we're further along today than we were a week ago. So, I mean, that's encouraging. I would love to see at the National Opioid Conference in November that they have a serious discussion about repealing the federal legislation that's impeding us from doing this more quickly, particularly in other areas in Alberta who don't yet have a proposal that's ready to explore further.
Right.
So the government, to their credit, allowed for additional needs assessments in other Alberta communities to pursue this avenue as one intervention for this public health crisis. But those ideas are not yet fully developed, and if we could get rid of the federal legislation, we could move a lot more quickly in those areas as well.
Okay. Well, thank you so much for your thoughts on this.
My pleasure.
Dr. Hakique Virani is an addictions and public health specialist. The province says it also intends to expand access to opioid replacement therapy and improve prescription drug monitoring and the collection and publishing of data.